How does elastic recoil affect your breathing? Imagine your lungs as a pair of balloons that love to stretch and then bounce back. When you breathe in, your lungs expand, filling with air. When you breathe out, they shrink back down. This bouncing back is called elastic recoil. It is a natural property of lung tissue that helps you breathe smoothly without much effort. During inhalation, your diaphragm and the muscles between your ribs contract. This makes your chest cavity bigger, pulling your lungs outward and making them stretch. The lungs are made of elastic fibers, which are like tiny rubber bands woven into the lung tissue. These fibers stretch as your lungs expand. The alveoli, the tiny air sacs where gas exchange happens, are lined with a thin fluid film. The surface tension of this fluid also helps the lungs stay elastic. Think of it like a drop of water that pulls inward, helping the alveoli keep their shape. When you stop inhaling and your muscles relax, the elastic fibers and surface tension work together to make your lungs recoil. This means they snap back to their original size, decreasing the space inside the lungs. As the lungs recoil, the pressure inside them rises above the pressure outside, which pushes the air out. This process is passive, meaning your muscles don't have to work to exhale. The stored energy from stretching during inhalation is released, helping push the air out easily. Two key things help prevent your lungs from collapsing when they recoil. First, surfactant, a special substance made by cells in the alveoli, reduces the surface tension of the fluid lining the alveoli. This keeps the alveoli stable and prevents them from collapsing under the force of recoil. Second, the space between your lungs and chest wall, called the pleural space, has a negative pressure. This negative pressure acts like a glue that keeps your lungs expanded and attached to your chest wall, even as they want to recoil inward. Elastic recoil is vital because it allows your lungs to breathe out passively, without extra effort. It balances the forces that expand your lungs when you breathe in. When you need to breathe faster or deeper, like during exercise, your muscles help push the air out even more. This shows how elastic recoil works with your muscles to keep airflow steady and gas exchange happening smoothly. Understanding this process helps explain how your respiratory system works efficiently with minimal energy use, keeping you breathing comfortably every day.